Medicine.
Hello guys, I am Dr. Robot. Today we are going to learn an interesting topic, malaria. Do you have any idea about malaria? Come on, malaria is a mosquito-borne disease caused by Plasmodium, which is transmitted by the bite of infected female Anopheles mosquito. Malaria is caused by 5 species of Plasmodium. The 5 species may include Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and Plasmodium noblesi. Of these 5, the Plasmodium falciparum is the most common and dangerous type. Malaria is a life-threatening disease that is caused by the parasites that are transmitted to people through the bite of an infected female Anopheles mosquito. Malaria affects 400 million people worldwide every year. In India, 2 million cases and 1,000 deaths annually. In this image, the yellow areas depict malaria-free areas. The pink areas are with limited infection risk, and the red areas are with high infection risk. Do you know who is more prone to malaria? 1. Living or traveling in a region where malaria is present. 2. Traveling to area where malaria is very common without taking any vaccines. 3. Pregnant women. 4. Children under 5 years of age. And 5. Patients with HIV. Now, we are moving to the important topic in malaria, that is, life cycle of malaria. Do you know, only female mosquitoes feed on blood. Male mosquitoes feed on plant nectar and do not transmit the disease. Malaria parasites can also be transmitted by blood transfusions, although this is very rare. Come on guys, I am going to explain this life cycle of malaria. Just follow the cycle from step 1. Malaria-infected female Anopheles mosquito inoculates a sporozoid into the human host, which is present in the saliva of the infected mosquito. Sporozoids infect liver cells. Within 30 minutes, they enter the parenchymal cells of the liver, where during next 10 to 14 days, they undergo pre-erythrocytic stage of development and multiplication. By mitotic replication of its nucleus, they mature into zygons, which rupture the liver cell and releases the merozoites. After this initial replication in the liver, the parasites undergo asexual multiplication in the erythrocytes. Merozoites infect the red blood cells, and thereby the erythrocytic cycle starts. The ring stage tropozoites mature into zygons, which rupture releasing merozoites. Some parasites differentiate into sexual erythrocytic stages, that is gametocytes. Blood stage parasites are responsible for the clinical manifestations of the disease. The gametocytes, male microgametocyte and female macrogametocyte, are ingested by an female Anopheles mosquito during a blood meal. While in the mosquito's stomach, the microgametes penetrate the macrogametes, generating the zygotes. The zygotes in turn become motile and elongated, that is ookinetes, which invade the midgut wall of the mosquito, where they develop into oocysts. The oocysts grow, rupture and release sporozoites, which make their way to the mosquito's salivary glands. Inoculation of the sporozoites into a new human host perpetuates the malaria life cycle. The parasite's multiplication in the mosquitoes, known as the sporogonic cycle. The common symptoms may include fever, chills, sweat, headache, nausea and vomiting, body aches, dry cough, lost weight, skin rashes, and the other symptoms include hemolytic anemia, jaundice, dark pigmented urine, stools became increasingly loose, hepatomegaly, splenomegaly. In severe malaria, it may lead to coma, metabolic acidosis, severe anemia, hypoglycemia, acute renal failure, acute pulmonary edema. Malaria is of 3 stages, namely cold stage, hot stage and sweating stage. As the name indicates, the stage 1 contains chills for 15 minutes to 1 hour and stage 2 contains fever which may reach up to 40 degrees Celsius, and stage 3 is a sweating stage which contains sweating. The following are the preventive measures. 1. Elimination of mosquito breeding places. 2. National improvements on health and hygiene. 3. Use of mosquito nets treated with pyrethrin. 4. Clothing with full sleeves and long trousers. 5. Use of mosquito repellents. 6. Children and pregnant women should avoid traveling to places where malaria is common. 7. Use of window screens. Finally, treatment. The World Health Organization has recommended artemisinin combination therapies (ACT) be the first-line therapy for Plasmodium falciparum malaria worldwide. As short-acting drugs, artemisinin compounds are given with 1 or 2 long-acting drugs like amodiaquine, mefloquine, sulfadoxine or pyrimethamine or lumefantrine. Thank you. See you all.